When you're in the midst of a traumatic event, a new illness or a new disability diagnosis, it's so difficult to know which way to turn and who to trust and what to listen to. The most important thing you want to know as a family member is that your loved one is going to a place that has the best possible care.
My name is Adam Kroupa. I'm 31 years old. This is my wife, Heather, who's 29, and we've been married for 6 years now.
So I was 8 months pregnant, and I was swelling a lot. I went to get my blood pressure checked, and it was really high. Josh was born that night, and he spent 2 weeks in the neonatal care unit.
We brought Josh home from the hospital, and Heather and I spent a great day together. Heather and I were in bed with Josh trying to get him calmed down for bed, and I asked a question. Heather didn't respond, and then all of a sudden I realized that the day that really had been the best day of my life suddenly became a nightmare. So I called 911. I wasn't sure if she had had a stroke, but I was concerned with the symptoms that she was showing that something was majorly wrong. They rushed her into emergency surgery that night to try to remove the clot in her brain. The doctor spoke to us and were very matter of fact, and they told us there's a 50% chance you'd ever get out of bed again. The early stages after Heather's surgery were a little bit difficult. She couldn't move the right side of her body at all. We had to help feed her. Heather was also diagnosed with something called aphasia. She couldn't remember my name. She couldn't remember what a clock was. Things that everyone knows, she couldn't remember. Within a short time after Heather had her stroke and her surgery, they did begin to describe and tell us that she would need to go through an inpatient rehabilitation facility. I knew when I was making the decision there was an option right down the road, and there was an option that was in the city of being RIC. The down the road option seemed maybe a little bit easier. I could come home in the evenings. But as I started to think about it, I was thinking if we could find something that would get her better, get her home, get her back to who she was, that's what I want. I want something that will do that as opposed to me being inconvenienced for a month or two. And I definitely think we found that.
When patients and families choose RIC, they're getting the best clinical care possible in the world.
Use your left arm.
The Rehabilitation Institute of Chicago is the only hospital to have been ranked #1 in U.S. News and World Report every year since 1991. What really sets RIC aside from other rehabilitation hospitals is our ability to combine excellent clinical care with excellent research. RIC has been ranked #1 by the National Institutes of Health as a research designation, and it holds federal designations for research study. Having researchers in the building work side by side with clinicians provides the best possible outcome, and has over 250 research projects in the building at any time.
Ready? Ready. Go.
Just this year, RIC opened a new patient recovery unit that brings together the best minds in research and the best clinicians. Heather was first treated on the inpatient floor at the Rehabilitation Institute of Chicago's flagship hospital downtown. After discharge, she continued her therapy at an intensive day rehabilitation program that was closer to home.
My care team was awesome. My therapists were great. What I wanted to do was I wanted to be Josh's mom. I wanted to be able to read him a story. I wanted to be able to pick him up out of his crib. I wanted to be able to give him a bath. So all these things together made me a mom, and that's what I wanted to accomplish.
Heather was at the RIC inpatient facility for only 2 weeks. In that time, she came in a wheelchair, and she left walking on her own.
As a family, we love to go for walks, love to push him on swings and do all this kind of active stuff. And to me, I just go out there and I do it. It's just amazing to me how much I've recovered. And it's even at the back of my mind that I had a stroke and that I was not able to do these things a year ago. So to be able to walk and run and to push him, that's the whole meaning of it all.
It's real easy to appreciate where things are when you think things are gone forever and you see what you've got today. It's pretty powerful.
At RIC, we treat people from down the street, from the western suburbs, from far-flung states in the United States, and from all over the globe.
For us, RIC was an answer to our prayers. We needed something that wouldn't be easy on Heather because we wanted her to work hard. We wanted her to excel. For us, RIC was exactly what we needed, exactly when we needed it.